What do horses and humans have in common when it comes to the spine? That's your hint for today's Sunday case study. I have a 57-year-old female who comes to my office with back pain. This pain has been there for about 6 months and it is severe. About a year ago, she sustained a fall in which she broke 2 bones in her back and was treated with a kyphoplasty, which is a surgery that they injected cement into the broken bones. That pain in her back was a little higher up and completely went away after the kyphoplasty. This pain seems to be totally different. She's seen numerous providers and no one's been able to find the source of her pain. She's underwent therapy and injections and nothing seems to help. Her pain with the compression fracture was a little higher up in her back. Now this pain is very focal and is pinpoint right here. A CT scan of her spine. Now to give you guys a little bit of a hint, I'm going to point out a couple of things. These are the bones that she's broken in her back that were treated with kyphoplasty, and her pain at that time was right here. Now her pain seems to be down here. So if we look at the anatomy down here, this is what we see. Here is the MRI imaging. Now what I do want to tell you as another little hint is she gets complete relief if she flexes her spine or arches her back, but the pain seems to be intensified if she extends her back or arches her back. So what's the diagnosis and how can we figure out if that diagnosis is correct? What's the treatment and what in the world does this have to do with a horse? Stay tuned tomorrow and I'll go through the full case. The answers to yesterday's case study has to do with the horse. So what does a horse have to do with the human spine? Yesterday's case, I presented a 57-year-old female who sustained a fall about a year ago and fell and broke 2 bones in her back that was treated with a kyphoplasty. Now, after the kyphoplasty procedure, that pain went completely away, but about 6 months later, she began to develop a focal spot in her lumbar back that was incredibly painful. She's seen numerous providers and no one's been able to give her an answer. She's tried injections, she's tried physical therapy medications, and nothing is really helping this pain. She does get relief when she flexes her back, but gets incredible pain when she extends her back or arches her back. So she finds herself leaning over all the time. And this is what I pointed out on the CT, that these are her levels that were kyphoplastied, but her pain seems to be lower down. So if we look at that area right here, this is the diagnosis. These 2 spinous processes are rubbing against each other. This is called Baastrup's disease or kissing spine. This is a common phenomenon that we see in horses. If we look at a model of the human spine, it sits in our body like this. And if we look to the side like this, we see these little bones called spinous processes. Now these bones are the same things we feel. If we push on our back and we feel a bony prominence, that's the spinous process. Now, the reason why we have spinous processes is for ligamentous attachments to the different types of muscles within our back. You see that the anatomy of a horse is very similar, where they have spinous processes as well. Now, what happens with horses is when weight is placed on the spine, like when sitting on a horse, it can buckle these spinous processes and they can rub together. And that hurts. In our patient, the reason why it developed in her case is because she broke some bones in her spine, which changed the actual lordosis of her spine. That caused those spinous processes to rub together, and over time, it just began to hurt more and more. Did in her case to make sure that we had the proper diagnosis is I provided an injection between those spinous processes with local anesthetic, and that gave her complete relief. So the diagnosis is kissing spine disease or Baastrup's disease, and the treatment is removal of the spinous processes, just like in a horse. So we just make a small incision overlying the spinous process and then go in with an instrument and just remove it. It's a simple, fast surgery. The patient did great and has had complete pain relief ever since. Stay tuned next week and I'll go through another interesting case.